I decided to focus my teaching plan on disaster preparedness of older adults. Older adults are members of the community that are 65 years of age and older. This population is considered a vulnerable population during a disaster due to the higher prevalence of chronic medical conditions, comorbidities, limitations in activities of daily living, impaired mobility, physical and/or cognitive impairments, and sensory impairments such as vision and hearing loss. The research available on disaster preparedness amongst older adults is limited. However, the studies that have been conducted have shown that many older adults lack an evacuation plan and also lack knowledge of community resources available to help them during an evacuation. Hurricanes and floodings are disasters that are of particular concern to the older adults of this community because these disasters often require them to evacuate. The goal of this teaching lesson is to better prepare older adults of the community for an evacuation. The first objective is that the students of this teaching plan will be able to prepare a disaster kit with essential items related to their physical and health needs for evacuation. This disaster kit will include the basic items in any disaster kit. Like the first one thing is water. 1 gallon of water per person per day is recommended. Food, a 3-day supply of non-perishable food items is required for evacuation. The supplies that would go in this kit would be additional supplies such as a battery-operated radio, flashlights, hygiene products, eating utensils. Special considerations that older adults or senior citizens need to make when preparing their disaster kit include the inclusion of vital and important documents. These documents usually would consist of birth certificates, social security cards, but also older adults have to consider medication list and medical records as important documents to put into their disaster kits. Also, many older adults may suffer chronic medical conditions and beyond any number of medications. It's recommended that these adults have a backup supply of medications in their disaster kit, at least a 7-day supply of any medication and medical equipment that is needed. There's a checklist provided in the handout that I'm going to attach to the teaching plan to help these adults to make sure that they include all of the essentials needed in their kit. Another thing is that during an evacuation, you need to have things for your vehicle if you're driving, such as maps, first aid kits, jumper cables, and flares. Many older adults have chronic illnesses and health-related issues that can complicate an evacuation, and also the stress of an evacuation can compromise the health of older adults. The second objective is that the students of this teaching plan will be able to develop written list of their medical history, allergies, medications, and medical equipment needed for an evacuation so that they can take that with them. The medical history list should include previous medical history, current medical history, and surgical history. The medication list should include generic and brand names, dosages, and frequencies. List of medical equipment needed, such as walkers, canes, wheelchairs, oxygen. Also, older adults should be encouraged to discuss evacuation plans with their healthcare providers. Their healthcare providers can possibly give them backup prescriptions to pack in their disaster kits, and give them further information about who to contact after an emergency in case they need refills on these medications. There's a fill-in-the-blank list provided in the handout to assist the participants in preparing these lists to take with them during an evacuation. Older adults may suffer physical limitations that prevent them from evacuating alone. The third objective is that the older adults will be able to formulate a transportation plan for evacuation. It's recommended that they identify a support network, family, friends, and neighbors, and discuss their evacuation needs with them, and to ask how they're willing to help you. Discuss and develop a disaster plan with your support network. Who will drive? Where will you go? Is there a meeting area? Can you carpool? Those kind of things. Also, for older adults who require assistance that do not have a social support network, they should be able to identify community resources to assist with transportation. One of these resources is the 211 program. The 211 program is a program in Texas where older adults can call and register for evacuation assistance. And not only does this program offer assistance with transportation during evacuation, but they also offer further assistance with recovery and additional needs of older adults after disaster. There's a brochure provided, and there's a lot of worksheets that I provided to help the participants of this lesson to prepare their disaster kit and prepare their medical history and medication list and allergy list to carry with them. And there's also a form to help them discover the best evacuation plans also. Thank you.